Which of the following action demonstrate appropriate infectious control practice? Is it select or apply, right? A nurse is caring for a client in a hospital setting. Which of these is appropriate? So look at each question and see if it's an appropriate problem. If it is, then you select it, but you have to bring your content. What is the issue? First one, a nurse uses an alcohol-based hand sanitizer after assessing a client who is what? On contact precaution for MRCA. There's buzzword there, MRCA, right? Contact precaution and an alcohol base. So if you have MRSA patient who is on contact precaution, is it okay to use alcohol-based hand sanitizer after taking care of that patient? If you think that is appropriate, then you select it because that's what the question is asking you. Underline the buzzword, put it together, and figure out what is going on. Next one. The nurse places what? A surgical mask on a client with influenza while in the assigned room. So when a patient is in the assigned room, the nurse places what? A surgical mask. Is this an appropriate infectious control protocol? If it is, selected. If it's not, forget about it. For select or apply, you don't have to guess. If you don't know, just let it be. And nurse wears what? A gown, gloves, N95 masks when entering the room of a client on what? Airborne precaution. Do you think this is appropriate? Bring your infectious control. If you need more content about infectious control, check Adapt NCLEX. I have a bunch of free videos. I show you how to answer these questions. They are straightforward, but they can be trappy too. And then it removes what? The gloves after exiting the room of a client on contact precaution for what? C. diff. Is that what you do? Think about it, right? The nurse remove gloves after exiting the room of a client on contact precaution for C. diff. A nurse wear gloves and gown when feeding a client who is on what? Contact precaution for C. diff. What do you think? This is infectious control. If you know the answers, you can put it there. But just tell me, what do you think? Is each of these appropriate? Which one is not appropriate? That's all. A nurse uses alcohol-based hand sanitizer after assisting the client with what? Contact precaution for what? MRSA. This is an appropriate problem, right? MRSA, you can wash your hands or you can use alcohol. But for your test, number one is alcohol. You don't need to wash your hands. Washing your hands means it's a strict requirement. The easy one is alcohol-based. So this is appropriate. A nurse places a surgical mask on a client with influenza while in the assigned room. In the assigned room, clients should not wear a surgical mask. So this is not appropriate. A nurse wear a gown, gloves, N95 when entering a room of a client on what? Airborne precaution. Of course, all of them feel appropriate, but for your test, the only requirement for airborne is what? N95. You don't need gown, you don't need gloves, unless you're touching the patient and the patient has wound. So this is inappropriate. And let's remove gloves after exiting the room of a client on contact precaution for C. diff. If you have C. diff, the gloves should be removed in the room, not outside. You wear the gloves outside and remove it inside the room. And as wear gloves and gown when feeding a client who is in contact precaution for C. diff. Of course, yeah. If you have C. diff, I need to protect my body and my hands, but I don't need a mask. Therefore, this is appropriate. And as you can see, there's only two answer choice there. If you see this in the NCLEX and you choose more than two, expect to get 0. So pick those you know you're confident, but bring your content. So the only answers we have is A and E. Okay, so that's the first one. Second one, same thing. A nurse is reviewing medical related concern. Which of the following clients require immediate follow-up? That means something is not appropriate. Something is not working. Something is not what I should expect. I have to be sharp about it. The patient is in trouble. The combination is not appropriate. Select or apply. What do you think? A client on clopidogrel will report what? Dark tarry stool. A client on lisinopril will report a dry cough for the past week. A client on warfarin on with an PT of what? 45 seconds and a small gum bleeding. A client on metformin scheduled for CT scan with the contrast in an hour. A client on levothyroxine will report feeling jittery and a heart rate of 120. Bring your content. Look at the situation. See if it's appropriate. If you have a 1 second, which one of these patients, like I said, in select or apply, don't compare them. Consider each patient one by one and analyze them as separate as much as possible. What is the problem? Clopidogrel, it's Plavix, it bleed, antiplatelet. I see dark tarry stool. You are bleeding. Lisinopril, cough for the past week. It's not an immediate problem. It may need the patient just to probably change the medication, but this is not an immediate issue. You see what I'm doing? A client on warfarin with a PT of 45 seconds and a small gum bleed. I put a small gum bleed there to trap you. A PT of 45 seconds, that's too long. Patient is going to bleed. The normal PT is what? 11 to like 13. If you're on Coumadin, it will go up to like 22 to 35. 45 is almost 3-4 times normal. This patient is going to bleed. We have to intervene. That patient, I don't like it. A client on metformin scheduled for what? A CT scan with the contrast in an hour. Lactic acidosis, lactic acidosis, lactic acidosis. I'm showing you these are really straightforward questions. You have to know everywhere you are. If you're studying, you're getting closer. These are questions you see, it should pop up like a candy, right? A client on levothyroxine who report feeling jittery and a heart rate of 120. Who know about this? What do you think? Should we intervene? Should this patient need immediate follow-up? But levothyroxine is going to speed things up, right? Use it for hypothyroidism patient. But when you start having this feeling jittery, and look at the patient heart rate, 120, of course, your heart rate is going to go up. But when you get to 120, that's excessive treatment. This patient medication needs to be adjusted as soon as possible. So this become a priority. If the heart rate is like 105, yes, that's what I expect when you're on levothyroxine. 120, it has gone too much, and then you're having jittery, that means you have gone too far. This is a problem. This patient, we need to intervene. This patient, we need to intervene. This patient, we need to intervene, and this patient. So those are the 4 patients you should do something like that. This is explanation. If you have adapting class on demand, you get access to this video explanation, detail, but straightforward. And next is assessing multiple clients on cardiovascular medications. They are taking cardiovascular medication. What do you think? Who need immediate follow-up? A client on norepinephrine for sepsis. And what do you see? Dry, blackened toes. The patient toes is black. A client on nitroglycerin patch. He has kept the patch on for what? 7 days. He's not taking shower. What do you think? The client using nitroglycerin patch, that stays on for what? 18 hours. 18 hours, don't removing the patch per day. Client prescribed nitroglycerin for angina and then a reporting headache. The client taking the Fedipine with what? Flushed skin and leg edema. Which of these should you worry about? I always say prioritization. And I said, you have to be sharp. What is be sharp? Is it a breathing issue? Electrolyte, shock, sepsis, airway? If it is, pick it. If it is not, stay away from it. Look at the number 1. If you have no epinephrine, what is an expected thing associated with that? Patient has sepsis. That means I'm going to pull all the blood from the extremities. Vasoconstriction. I expect what? Vasoconstriction to occur. Your leg is not going to get blood. What is going to do? It's going to look black. And if it look black, it's going to what? Die. This is an expected finding. But even that, This is dry. Dry means there's nothing you can do about it. Dry ganglion is gone. There's nothing you can do about it. So don't pick it, but use the content. Nitro patch, 7 days has not taken shower. You should not keep the shower because there is a nitro patching means doesn't mean you can't take shower. You can take shower with the patch. So this patient need to be taught something. He need intervention to educate them about it. You have a nitro patch, you keeping it on for every day for 18 hours. That means you keeping it off for close to like what, 6 hours. No, that's wrong. You have to give yourself 10 to 12 hours nitro patch free time. So you got to take it off at least 10 to 12 hours. So you keep it on for probably 14 hours a day, and the rest you let it be. Otherwise, it stop working. This is the teaching you provide. When they give you risk reduction question, nitro patch should not be on for 24 hours. They can stay on, but you got to take it off 10 to 12 hours as the time to recover from it. Client is prescribed nitro. He has headache. Expected finding. Should not cut the nitro into half. Should not lay down. All they can do is to take some Tylenol, right? Acetaminophen to help with it. These are little teaching thing you know is coming. Nitro is a big medication. You should know everything about it. Patient taking nifedipine and then he has flawed skin and leg edema. First of all, try to figure out what is nifedipine. This is a calcium channel blocker. A calcium channel blocker is going to make your vein bigger. That means it's going to cause venodilation. Blood stay in your leg. If blood pool in your leg will become bigger, edema. Your face, blood pooling will look flush. You're going to have headache. These are all expected findings. Don't pick it. Use the content to answer it. Therefore, which of this is an expected finding? Which one we should pick? Keeping the patch on, not taking shower for 7 days is not good. Need education. Keeping the patch on for too long, need education. Right? So those are the two questions that need. The rest are all expected finding. Okay, so that's that one. How about this? This is an endocrine, 5 endocrine thing. Like I said, if you know the answer, you can put it, and then if we can talk about it. And this is caring for several clients with endocrine disorders. Which of the following clients require immediate follow-up? Select or apply. What you do is look at each content, see if it's an expected finding, see if you know it. The first one, a client with grave disease. What do you know about grave disease? Too much thyroid hormone. Who has heart rate of what? 104. And then weight loss. Is this what you expect in a patient with grave disease? If it is, then don't worry about it. I have Addison disease. I'm nauseated. My blood pressure is 88/54. Is this what you should expect? If you expect, is it okay to let go? You have to be sharp. Cushing patient, he has weight gain, moon face, purple stria in the abdomen. Is that what you expect? Right? Type 1 diabetes. What is happening? Blurred vision, glucose of 52. Is this okay for this patient? Pheochromocytoma, they have excessive sweating and palpitation. What do you think? These are content. You should not let it go away. Master it. And when you see this, you just laughing. You just see it and say, oh, I know what it is. They can't trap me. What do you think? Grave disease, heart rate of 104. It's not the same thing we saw with the heart rate of 120. 104 is okay. And he has weight loss. That's fine. Addison disease is nauseated and is hypotensive. That's Addison crisis, right? That's a bad problem. Cushing with the weight gain, moon phase, they are all normal finding you see in Cushing patient. But if you have type 1 diabetes with the blurred vision and what? Hypoglycemia, right? What is that? Bad problem, bad problem, bad problem. The glucose is 52 and I have blurred vision. That's bad. Pheochromocytoma, bunch of norepinephrine floating around, a bunch of dopamine, a bunch of catecholamine. What is going to do? It's going to speed things up. Therefore, you're going to sweat. I call it the 5H. You get headache, you sweat, right? You have hypertension. Those are all things. You have palpitation, all of them associated with pheochromocytoma. Don't let that trap you. That is an expected finding. So what do you think is your answer? I've explained everything to you. Therefore, B and D is in trouble. Okay. Now, let's see if we can get this done. If you know the answer, you can type it. Who need a follow-up? Patient is on digoxin. His potassium is 4.5. 2. Patient is on digoxin and he's taking nifedipine for hypertension, calcium channel blocker. Patient is in digoxin. His apical heart rate is 95. This is an infant. Patient is on digoxin. He has nausea after oral intake. Patient is digoxin. His creatinine is 2.5. What do you think? Whose situation is bad? You have to know the content. You have to know the side effect of digoxin and which one is worrisome. Digoxin with the potassium of 4.5, which is normal, it's not the problem. The digoxin and you taking calcium channel blockers is an issue, but it can be monitored. It's not that bad. I mean, because most patients can be on calcium channel blocker. You got to watch it. But if you have digoxin and you are a kid, infant, your heart rate is 95. So far as it's greater than 90, it's okay. If you have digoxin and you have nausea, that's not good. If you have digoxin and your creatinine is 2.5, that's not good, right? These are all bad problems. But you have to watch it. These sometimes you may see it somewhere. They will tell you the calcium channel is possible, unless there's nothing in the question that worrisome. But this is also a problem. Calcium channel blockers, and then oral intake nausea is a problem, and then creatinine that is high is also a problem. So these are little things you have to know. But patients can be on both digoxin and nifedipine. Is the way they will frame it that you can know. So B, C, and D, and E are the right answer. But these are little things that you should know about digoxin. Next question. Which client should be prioritized for immediate follow-up? That means we have to take care of them right away. The client on losartan who says they avoid banana, is that okay? I avoid banana as much as possible. I have losartan, I'm avoiding banana. A client on enalapril who is 3 weeks pregnant, should you worry about that patient? A client on enalapril who reports that the necklace no longer fit for the past 3 days, should you worry about it? I have enalapril, my peak T wave on EKG, should I worry about it, right? I'm taking spironolactone, my potassium is 3.5. This can be trappy, but think about it carefully. Think about it. Think about it carefully before you select the answer. Now, losartan is going to increase your potassium, right? Patient is avoiding banana. That means potassium is going to decrease. This is going to balance. This is okay. You're pregnant, 3 weeks, you're taking ACE inhibitor. ACE inhibitor is a what? Teratogenic. What do you think about it? Enalapril, and your neck is bigger. You can't put your shirt on. Your necklace cannot fit. Well, what do you think? Enalapril, and I have peak T wave on my EKG. What do you think? Spironolactone, my potassium is 3.5. What do you think? Bring your content, right? Hyperkalemia problem, avoiding potassium, This is okay. Don't worry about it. Enalopro, I'm 3 weeks pregnant. I got to worry about it. Teratogenic, right? Enalopro, my necklace does not fit. That's angioedema. I got to worry about it. Enalopro, I have peak T wave, hyperkalemia. I got to worry about it. If I take spironolactone, my potassium is 3.5. Think about it. Spironolactone is going to increase your potassium anyway. So if your potassium is 3.5, this is also low normal. It's going to go up. I'm not going to worry about it. So this is all normal. The spironolactone will bring it up anyway. If I give you potassium, the spironolactone will give you more potassium, and you have hyperkalemia. So these are like pharmacology, bringing the content related to that. And you can see that this is not right. You don't have to pick it. But if you have EKG changes, if your necklace does not fit and you're pregnant, those are all bad problems you should not consider as normal. So that's one. And the last two, which of the following the nurse should prioritize for further assessment? That means we got to assess them again. CHF patient is taking what? Eperinol and furosemide. You have to recognize those medications. Chlorothalidone and your glucose is 220, right? You take propanolol and you have asthma, right? Amiodarone on grapefruit juice and simvastatin, and you drink grapefruit juice daily to prevent UTI. What do you think? This is another one that I put it together to trap you, but if you understand it, trust me, if you see this medication here, you don't forget them. You have CHF. Okay, fine. I give you this. Eperinol and furosemide. You know furosemide is for what? CHF. Both of them are diuretic, but they're different kind of diuretic, right? This is potassium depleting. It decreases your potassium, spironolactone. Eperinol is potassium sparing. It's like spironolactone. So take these off if you recognize it and put spironolactone there. If you put spironolactone, you know this will increase your potassium, and then furosemide will decrease your potassium. This is equal to normal. Therefore, that is an expected finding. Chlorothalidone will increase your glucose. This is expected. I call it hypergluc. It's an expected finding. Don't worry about it. Propanolol is what? Non-selective beta blocker. Asthma patient hates you. They don't like you. If you give them propanolol because they're going to have bronchospasm. Asthma patients are safe with the balm. Amiodarone, you should avoid this. Grapefruit juice because it's going to increase toxicity of amiodarone. If you take simvastatin is going to, and you drink grapefruit juice, your toxicity is also going to increase. This is how they do prioritization. What do you think is the answer? Number one is unexpected. We don't need to worry about it. Number two, we don't need to worry about it. Number three, yeah, beta blocker is non-selective. These two are also a problem. So these are some of the three answers you should watch. And the last one. A nurse is caring for a client with influenza. Which of the following actions are correct? I feel like infectious control, you should be good at it. When you wake up in the morning, give you infectious control question, you should haste it without letting them trap you. A nurse places a client, what? The surgical mask on the client with the influenza when they are in the assigned room. Ask yourself, if you have influenza, what kind of precaution? And when that precaution, should I place a surgical mask on that patient when they are in the assigned room? Number two, the nurse wear a sterile surgical mask when entering the room of a client with influenza. Should the nurse do that? A nurse places a surgical mask on the client when leaving their room for X-ray. should the nurse put surgical mask on this patient going to get X-ray? And nurse instructs the transport personnel to wear a surgical mask when transporting the client to the surgical X-ray department. Should the nurse do that? And then the client door remain closed at all times. Is this part of the infectious control protocol? This is what I teach in my crash course, which is coming up next week. If you don't register, you should try Adapt NCLEX, www.adaptnclexreview.com, and register. You master this thing. It's very cheap. The less expensive, high yield content you have to master. You don't have to pass the NCLEX by spending too much money. It's a small token for the time. But these are content I teach, and it's so easy, the infectious control. You have to know what are the things you do in droplet precaution, right? The door does not need to remain closed at all time, right? The patient does not need to wear a surgical mask in the assigned room. You see, it's wrong. The nurse does not need to wear sterile surgical mask. These are the things I teach in my crash course to show you. These are little things you say, oh, I did all these things, but I failed because the little attention to detail. Nurse should not wear what? A sterile surgical mask when entering the client room. It's a regular mask, not a sterile one, right? The nurse places a surgical mask on the client when leaving the client for X-ray. Yeah, if the patient is leaving, they should wear that. The nurse instructs the transport personnel to wear a surgical mask when transporting the client to the X-ray department. The transporter should not wear anything because the patient is going to wear a surgical mask. If you overselect, you get 0. This is wrong. This is intentionally set to show you that you have to master this little detailed content when it comes to infectious control. It's about 20% of your test. You have to kind of master it, because they're coming, they're coming. So why would you have to let them take the point from you? You see, only one answer there. If you select more than one, you get 0. So these are the things you need to do for droplet precaution. Only one answer there, right? Only one answer choice there, right? And that is this. The nurse places surgical mask on the client when leaving. The nurse does not wear a sterile surgical mask. The client does not wear what? A mask when they are in the assigned room. And then the transporter does not wear anything because the patient will wear surgical mask. The door does not need to be replaced. Closed at all time. Thank you for watching. And this is Adapt NCLEX. Like I said, if you need more content, you can subscribe to our channel. You get free content. There's a membership too.